All right. My name is John Raphael. I'm with the National Alliance for Direct Support Professionals, and I'll talk a little bit in a moment, but I am going to immediately hand it off to our friend and the executive director. I believe that's your title, Mike. Mike Brojali. Mike Brojali, to you.
Thank you, John, and thank you for pronouncing my name properly. I appreciate it. I am Mike Brojali. I'm the executive director of TASH. TASH, for those of you who are not familiar, we advance equity, opportunity, and inclusion for all people with disabilities, with a focus on those with the most significant support needs in the areas of education, employment, and community living through advocacy, research, and practice. So we're really very glad to partner on this vaccine outreach project, which we've branded in our organization as TASH Cares. And we're happy to work on sponsor this webinar along with NADSP. And our aim, collective aim, is to raise awareness about the health benefits of COVID-19 vaccines, including the latest boosters, as well as the benefits of flu and Mpox vaccines for people with disabilities, family caregivers, and direct support providers. I want to thank NADSP for partnering on today's webinar. And I want to thank all of our panelists as well. We're really fortunate to have you here with us. So we're looking forward to the presentation on this critically important, ever important topic. So thank you also to all of our attendees. We have a great turnout today. We're glad you're with us. So I'll turn it back to John, who will introduce today's presenters and moderate the webinar. Thanks again.
Mike, thank you. And from a fellow Italian person, names and pronunciations are very important. Welcome, everybody. Again, my name is John Raphael. I'm the Director of Educational Services with the National Alliance for Direct Support Professionals, and we are thrilled that you're all here and that our panelists are here. We have been working diligently, really since the onset of COVID-19, back seemingly years ago, and we're going on 3 years. Was 4 years of this pandemic, right? And we work tirelessly to make sure that people with disabilities and direct support professionals, those people that support people with disabilities, had as much information as possible, not only about the virus, but about protecting oneself, and certainly when vaccines became available, how to promote the vaccination process for people. We have this project, this particular webinar is being sponsored by a grant, obviously, and really truly the work of the Association of University Centers on Disability and the Centers for Disease Control. They have funded many organizations in the effort to promote information about, obviously, COVID-19 vaccines, and now vaccines for other things, as Mike indicated before. Just a couple housekeeping things. Closed captioning is available. If you go to your Zoom toolbar, you can hit captions and get some closed captioning. We also have Linda, our ASL interpreter, who is just wonderful, and you see her there. Please utilize her. Feel free to put questions or comments in the chat box. We can't guarantee we're going to get to everything and everybody, but we're going to monitor those questions or comments, and we'd love to hear from you. And in fact, if you could just even put in the chat box where you're from, where you're dialing in or interneting in from. All right, we'd love to hear and see where you're from. Let's get to it. The first part of our webinar today is going to be a presentation by Caitlin Jetelina, and I think I pronounced it right, Caitlin. And Caitlin, if you don't know her, you're going to know her now. And once you know her now, you're going to be following her like pretty much everybody on this webinar follows her in terms of her work to help us understand in plain, clear language, epidemiology, if you will. So I'm going to shut up and I'm going to give it to Caitlin. And when Caitlin's finished with her presentation, we're going to have a discussion with 2 other important people in our world. And I'll introduce you to those folks when we come back after Caitlin. So Caitlin, it's all you.
All right, thank you for having me. Let me share my screen and get this PowerPoint going. Okay, I am just going to assume you can see it, and I am going to start. So I am Caitlin Jetelina. I'm an epidemiologist. I think one silver lining of the pandemic is I no longer have to describe what an epidemiologist is, that we are not skin doctors, but rather we look at patterns of health outcomes, and in this case, SARS-CoV-2. So I was asked to give an update about what we're currently seeing today, what we're paying attention to in the short term, as well as kind of what we're paying attention to the long term, particularly around policy and where I think a lot of your advocacy could help. So current state of affairs right now. Right now we are experiencing a wavelet. This is a graph of SARS-CoV-2 and wastewater over time. And the reason I have wastewater is because we're no longer paying attention to cases. They're just not a good indicator anymore of the true picture of transmission, given underreporting and at-home tests and people just not testing anymore. So this is wastewater. You could ignore the colors because the colors are just the regions of the United States, but I highlighted where we're at today with a rise in infections. Certainly not as high as we've experienced this past winter or in previous waves, but it is noticeable. But this shouldn't be a surprise because circling right here, we have seen a summer wave throughout the past 3.5 years. And there's a few reasons we experience a wave in the summer. I will say it's typically not what we see with respiratory viruses because viruses thrive in winter. But we are seeing it with SARS-CoV-2 uptick in summer, and there's 3 main reasons because of this. One is just variants. Omicron continues to mutate, and the latest subvariants of Omicron are helping push this summer wave. As we see here, XBB, which is one Omicron subvariant, is getting smaller and smaller over time, with another Omicron subvariant called EG.5 really growing and taking over. And EG.5 is what's really pushing some of this wave we're currently seeing. Another reason we see summer waves is just because of behavior change. It's really ridiculously hot out there, so people are moving inside, and that helps the virus thrive as well. And then 3, our susceptibility pool. Our last major wave was about 6 months ago, and due to waning immunity and waning antibodies, people are just becoming more susceptible to infection today, which is also driving this current wave. If we zoom in to the current wave, I just pulled this yesterday. The good news looks like acceleration is slowing, and we should be peaking soon. This also shouldn't be a surprise. We have seen the previous summers usually peaked in August or September, went down a little before the fall and winter surges. We are currently today seeing an increase in hospitalizations. We've seen this throughout the pandemic, and it hasn't changed, that hospitalizations continue to lag wastewater and cases by about 3 weeks. Last week, again, hospitalizations rised about 20%. The good news is that it's starting from a low absolute number. So we're certainly not near the peak of last winter like we see in this graph, which is, of course, helping hospital capacity, for example. Hospitalizations is importantly continues to be driven by mainly those over 60 years old. And this is mainly because of their weakened immune systems. But I think it's also important that although hospitalizations are rising, it's qualitatively, hospitalizations these days are very different than in the beginning of the pandemic. We aren't seeing, for example, pneumonia and ventilation and going to the ICU as much as in the beginning of the pandemic, mainly because our immune systems are really kicking in. The majority of hospitalizations today are still for COVID, but more so because COVID-19, the virus, is complicating other comorbidities like diabetes and heart disease, for example. And we can see this in this graph. While hospitalizations have been ebbing and flowing with that light gray line, those in the ICU, or that dark gray line, has remained relatively stagnant, which is, of course, good news. And then, of course, deaths continue to lag hospitalizations. Deaths are very low right now, I will say only, it's about 300 per day. This is compared to the peak, which we saw about 3,500 deaths per day. And of course, this is due to a lot of immunity, particularly of vaccines. Like I highlight here, we are still seeing that vaccines continue to help. The majority of deaths are still among the unvaccinated, and particularly deaths among those that are not up to date with their vaccines. Okay, so that's currently where we are right now. I was asked to kind of give like a short-term forecasting about the upcoming fall and winter. The upcoming fall and winter is on a lot of our epidemiologic minds, and we are a little concerned about this winter, and there's a couple of reasons for that. One is that RSV and flu are back. And I'll walk us through this graph, but during the pandemic, the patterns of respiratory viruses greatly varied. And this is because basically our behaviors drastically changed, right? Masks, closed schools, stay-at-home orders. And because of that, we almost saw no flu and RSV in the first 2 years of this pandemic. So this graph is from a database. It's a CDC graph of influenza-like illness, ILI data. And this is a database which basically providers tally the number of patients they see with a fever, cough, or sore throat at their office. So these numbers include everything: flu, COVID, RSV, and really a general indication of the climate of respiratory health in the United States. So in 2020 to 2021, we basically had no flu, very little RSV. In fact, it stayed below our epidemic threshold, which is that dotted horizontal line. We also see that in 2021 to 2020, we started also having a little more influenza-like illnesses, including an increase in RSV, and but flu stayed particularly low too. Give me 1 second. I was just told my computer's gonna fall asleep unless I plug it in. 1 second.
No problem. Take your time. Give it juice.
Yeah, we don't wanna lose this.
Excellent. Thank you.
Okay. So 2021, 2022 had low respiratory activity as well. Then last year happened, and flu and while we had kind of a middle of the road flu season, our RSV season was out of control. And as you can tell from this graph too, it was uncharacteristically early. It was peaking in November and December. Here's a better graph of hospitalizations for each one of the big 3 respiratory viruses last season. COVID-19, which is that red line, did take the cake for the most hospitalizations. The other thing I want you to recognize is that all 3 of these peaks staggered. I mean, honestly, this is the best case scenario that we can ask for this year, is that RSV peaked, flu peaked, and then COVID peaked. Because this is good because our number 1 concern is hospital capacity. This is unfortunately the bedrock of our society, and we have not improved capacity, although we've added a new repertoire of our threat, COVID-19. And this is concerning because even during a bad flu year, pre-pandemic, our hospital systems would reach capacity. We also have record burnout from physicians and nurses, and they're leaving in droves. So again, the staggering helped. We're hoping that we see this again this season, really to be determined. So all of our respiratory viruses are back. The other reason we're paying attention to this winter is because SARS-CoV-2 continues to be unpredictable. This is a graph from Marin County, which is in San Francisco, outside of San Francisco. And the 2 bottom graphs is flu and RSV, and you can clearly see seasonality, right? They increase and then they decrease. But what we see on the top graph is COVID-19, and we see that it's not necessarily predictable or seasonal, and it's not even endemic. And so while we're anticipating a COVID-19 wave this winter, because coronaviruses thrive in winter, it's also could not happen at the same time. We're not entirely sure what COVID-19 has up its sleeve. Another sign of unpredictability is something that just popped up in the last few weeks is how this virus is mutating. So since Omicron came on scene in November of 2021, the next subvariant has come from the last. And we see this in panel A, that we start seeing this ladder-like evolution of patterns. And coronaviruses typically do this. The flu does this too. And we want this ladder because it means we can predict where this virus is going. However, like I said, a few weeks ago, a new variant popped up of COVID-19 called BA2.86. And this variant did not emerge from a ladder. It came out of nowhere, something like this panel B that we're seeing. And so we don't know if there's going to be another Omicron-like event like we saw in the winter of 2021, but we're keeping a very close eye, especially this fall and winter. Because what it's like we're seeing a storm in the distance right now, and time will tell if it really sizzles out or becomes kind of a Category 5 hurricane or somewhere in between. The last reason we're paying attention in this winter is because of suboptimal use of our tools. COVID-19 vaccination rates is a great example. We were doing great at first. 91% of Americans over the age of 12 got at least one dose of COVID-19 vaccine. That's huge. I don't remember the last time 91% of Americans agreed on one thing. However, last fall, we updated our vaccine formula and vaccination rates were abysmal. And we don't really expect something different this fall. For example, last fall, only 17% of the general population got a COVID-19 vaccine, while 42% of those over age 65 did. For the record, this is much lower than we see with flu vaccinations, where we see about 50% uptake. And so this is concerning, and we are paying attention to this fall. Another tool we're not using enough is Paxlovid, this antiviral that slows down the replication of the virus in our bodies. This is a graph I helped the CDC create, and it shows that among those over 80, and even really anyone, Paxlovid is not being used. For those over 80, for example, only 30% get Paxlovid after an infection. This is about the same rate at those age 50 and older. So this is not great either. And another reason we're particularly paying attention while we expect a surge. So I was also asked to comment on what to expect in a post-emergency world. So even beyond this fall and winter, what are we kind of expecting in the long term? Well, us in public health don't really have a word for the moment. This moment of post-emergency, post-pandemic, but before endemic, before predictability. The WHO Flu World calls this a transition phase. And I asked Twitter what we should call it. They mentioned tweendemic, interdemic, tired AF, but it's essentially this weird time, a tug of war between normalcy and urgency, partly because we don't know what this virus is going to do, but also because this is the post-pandemic world, financially and administratively, at least on the national level, the tools are just not there anymore. And we are also coinciding this with pandemic fatigue. So a lot of us in public health are really focusing on this recovery and preparedness phase of this transition and inter-pandemic phase that we are entering right now. One part of looking into the future and the unpredictability of COVID is to note that even though we may be in this post-pandemic emergency world, that doesn't mean there will not be any suffering. The COVID-19 Modeling Hub, I think it's 8 academic teams across the United States. They advise the CDC on what we're kind of going to see. And they put together models and projections for the next 2 years for COVID-19. And these are 4 situations, and they're all differ based on vaccine uptake and how this virus mutates. But overall, what they're saying is that hospitalizations and deaths will likely stay within last year's range. Unfortunately, this means that we should expect to lose about 55,000 Americans in the optimistic model, and the pessimistic model is an upwards of 450,000 Americans due to COVID-19 in the next 2 years. This means that COVID-19 will continue to be a leading cause of death. In 2020, 2021, and 2022, COVID-19 was the third leading cause of death, which means it was killing us about 4 times more than the flu. The projections that the CDC hub gave us would place COVID-19 in the next 2 years anywhere between the 3rd and 9th leading cause of death. So, what should expect in the post-pandemic world? I think that a little less sciencey and a little more behaviorally is really important to look that, unfortunately, as time goes on, we're going to continue to move away from a population level approach, this collective response, to a more individualized approach, particularly in the United States. This collective response is running out of steam really fast and hitting a lot of inertia. Again, because of pandemic fatigue, because of cognitive dissonance, because of the end of the pandemic and what that signaled last May, and because we're just running out of money and resources. So this means that how safe and healthy an individual is largely dependent on what we do as individuals, given our risk tolerance, rather than a policy or a population level approach. But in the next couple of years, it doesn't mean we've given up on a population level approach. There are really 3 ongoing policy focuses on the population level. The first one is, and it's in the short term, is mask mandates in hospitals. We've had several studies showing the effectiveness of masks reducing transmission in high-risk settings like hospitals and nursing homes. I know that some counties, particularly in the more liberal states, are already preparing to reinstate mask mandates for November to March of this respiratory season. So I think that we can expect mask mandates in high-risk settings, particularly again in hospitals and nursing homes, to be implemented this upcoming respiratory season. A more long-term policy that I think that you can expect is air quality. So one big lesson we learned during SARS-CoV-2 is how much improving indoor air quality is a powerful mitigation tool that's really been underutilized throughout the pandemic and even before the pandemic. You know, I think it's been underutilized because some of the best public health interventions are those that are happening in the background. They're institutional level interventions that work passively and invisibly on the individual level. And we're going to see a lot more focus on this, specifically in schools and workplaces. And again, hospitals already have great air ventilation, but also nursing homes. There's problems though. So this is a great depiction the New York Times did, I think in like 2020 or 2021, showing infection of SARS-CoV-2 in the air. And I think about it like smoke from cigarettes, that without windows opened or fans and air cleaners, that it really just stays in the air for hours and hours on time and can infect people, even if that currently a contagious person isn't still in the room. But I will say, I think there's a lot of space in the policy world, particularly around advocacy around air quality. I think one really striking statistic I keep going back to is schools, that most schools have spent less than 50% of the funds allocated during the COVID-19 crisis. So this is millions and millions of students in their schools, or particularly the school districts, are not spending federal money that should be used, particularly around this indoor air quality. These funds are still available, and I think a lot of it is getting word out that schools should be using this money. The third long-term policy happening in the background is called Operation NextGen. May of this year, 2023, $5 billion was allocated to this Operation NextGen, which is supposed to follow Operation Warp Speed. And it has one goal, That goal is to speed the creation of next generation COVID-19 vaccines and therapies, and this includes nasal vaccines. So right now we have an intramuscular vaccine, and I'm gonna have a picture of this. Here it is. And this vaccine is doing a really great job of protecting us against severe disease and death. That's because our immune responses are really pretty deep in our immune systems. But what it does not do a great job at is transmission or preventing infection in the long run. And so mucosal vaccines, like the ones administered in the nose, stimulate an immune response in the same portal the virus uses to enter our body, the upper respiratory tract, which is shown in blue. And in theory, these mucosal vaccines would help prevent infections better than the vaccine that is injected. There are some major scientific challenges to this, though. We do not have a great intranasal vaccination. There are many coming through the pipeline in clinical trials, but it's going to take a lot of time to get one to work in the way that we want it to. So I think this is definitely longer term, but it is in the pipeline and getting pushed in the policy perspective. So I am over time, I think, but I just wanted to conclude by saying that the emergency is over. That does not mean that COVID-19 is over, and certainly not the suffering is over. Respiratory season is upon us, and hospital capacity is of utmost concern for the majority of communities. And there's this population protection momentum hitting inertia, which means that a large proportion of how we protect ourselves is unfortunately placed on the individual. But we do have a few pushes left in the policy world that I think that you can expect coming down the pipeline. So this is it. I think I'll pause there, and I think we're going to do questions later. Is that right?
Yeah, we could do questions later, and people can put them in the chat box if they want. But Caitlin, thank you for plain language, understandable stuff that otherwise would boggle most of our minds. You put it in a really wonderful framework for us to understand what's going on and what an epidemic and epidemiology is. So thank you. Thank you so much. So this is the last half of this webinar is important because we want to also talk to people who are on the receiving end of, unfortunately, maybe getting COVID or having gotten COVID, but to kind of drill it down to people with disabilities. And we know, and Caitlin, you know probably better than anybody, that when people with disabilities, intellectual, developmental disabilities, contracted COVID, there was a likelihood that the mortality was higher. And we get that, we understand that. But we also know that direct support professionals, people who are those incredible people, 1.5 million strong in the United States, who support people with developmental disabilities, they got in the middle of so much during COVID and during the pandemic, and so much lack of good information, misinformation. And despite all that, they showed up and they made sure that people with significant disabilities were supported. So we thought the last half of this session could be a discussion with two people with very much lived experience. So that's what I'd like to introduce right now. Caitlin, please join us and for this conversation too. This is going to be very informal. I've got a couple questions that I'm going to ask our esteemed panelists. And if we could spotlight them, that'd be awesome. And I don't know, Nicole, I don't know if you could do that and get, there we go. Wow. There we go. All right, wonderful. Hello, esteemed panelists. Let me introduce real quickly my friends and colleagues, BJ Stasio. And BJ is an incredible human being who I love a lot, who lives up in Buffalo, even though he likes the Buffalo Bills. He's a man who has taught me a lot about self-advocacy and advocacy. And he's going to speak on his experiences. And then a person that I've known for quite a while, who is a direct support professional, also a manager in developmental disability services, and that's Nikita Smith Rashad. I hope I didn't kill that name, Nikita.
That's good. That's good.
We-
They're good.
I'm very sensitive with the names, as you can see. So look, thank you all for joining us. And so this is what I want to start with. And it's a kind of a reflection question, because I think it's important for us to reflect. I've been reflecting on remember how we used to put mail out in the sunshine to kill the COVID? Remember how we used to wash groceries? Remember those days? I think we all had those. Certainly at the early part of the pandemic, we were doing things that were just seemingly outlandish, but we were so afraid. And I think we all learned from some of the stuff we did. We probably look back and some of the stuff we did was silly, but maybe it wasn't, in light of being scared about this terrible disease that, was spreading around the world. But I thought this is the question for both Nikita and BJ, and certainly you, Caitlin, if you want. What was a memorable moment? I mean, we had lots of memorable moments during the pandemic, I'm sure, but was there a significant or particularly memorable moment for you that you recall? Something that maybe an epiphany moment, or maybe a fearful moment. So let's start with you, BJ. Did you have anything that you remember that really stuck out in your experience during the pandemic?
Well, yes, John, there were a couple things. The isolation that started when COVID happened, like the DSPs had to wear the protective gear to come in. And then once I got COVID, that's when the isolation really happened. I didn't see them for what was then 10 days. And the isolation was just because I relied on them for a lot. Not that I needed social interaction, because I used to go outside a lot, and for me to be in the house and just on the computer, that wasn't enough socialization for me, because I'm a very social and want to get out there and fix things kind of guy. You know that. Yep. It was just the isolation, and getting the COVID was the whole other thing for me. Like my doctor said, she's like, you're really in a dangerous situation now, because on top of that, you have respiratory issues of your own minus COVID, and it's like, you need to be careful. And she always says to me, still to this day, the next time it could kill you, so you better be careful. And I'm like, I'm going to worry about that when it happens. I'm not going to worry about it now. I'm not going to be one to sit there and worry, because I have a lot of things I need to get done, a lot of advocacy to do. I'll worry about it when the time comes. If I'm in a large crowd, I'll protect myself, and I'll do the things I need to do that I learned from the experience of COVID times that I needed to do, like the happy birthday song, 20 seconds, wash your head. That's one thing I learned during COVID time, 20 seconds, because it takes 20 seconds to sing happy birthday. That's how long you should wash your hands for.
Yeah. Let's ask Caitlin real quickly. Is that accurate? Is happy birthday a good song to sing if you wash your hands? Is that going to kill the germies?
I think that's a great idea. I'd never heard about the happy birthday song. I've heard of other songs, so I'm going to start singing happy birthday.
I like it. So there we go. Thank you, VJ. Nikita, how about you as a direct support professional? And obviously you're also a mom. So you had lots of things to worry about, right? People to worry about. How about you? A memorable moment during the pandemic?
I want to piggyback off of what DJ said about the isolation. We actually did lose someone to COVID in the group home that I work at. And we had some other very scary moments with the remaining individuals that live here. And when it came time to tell everyone that their friend had passed away and their families, they couldn't even come inside. Like they gathered around the window, and there was like a glass between them, and all of us staff were wearing gowns and masks and gloves, just 'cause we knew we'd all be crying and trying to comfort each other. But we also want to stay 6 feet apart and adhere to the guidelines. And it was really heart-wrenching. And I honestly, until BJ mentioned isolation, I kind of forgot about that part, the part where we tried to work around the distancing while we tried to comfort everyone, including the families, and the fact that they couldn't come inside. That was really hurtful. So that was the biggest, that whole ordeal surrounding that was like the biggest thing for me in the pandemic.
Thank you. Yeah. And again, sorry for that loss. But Caitlin, anything that stands out as an epidemiologist? My gosh, that must have freaked you out. Well, we've got a pandemic. What anything that stood out?
Yeah, there's a lot that stood out, but I was just trying to think, like the first time I knew it was going down, because we were watching it, early January, a lot, very much before a lot of the general public was in the United States. And when I knew it was going down in the United States is when the Vegas casinos closed. And I was like, okay, and the NBA games were canceled too. And I was like, all right, here we go. And so that reminds me of the super early times of, as an epidemiologist, seeing the society react was pretty surreal.
Yeah, no, really incredible moments of memory there. Thank you for sharing those. Mine is washing the groceries. I still go back to that, and I thought how that was going to keep me safe, and then we realized that no, I don't have to wash the yogurt container. I can have the yogurt with not worries that I'm going to get COVID from the yogurt container. Next question. Let's go a little bit in the middle of the pandemic, the first part of the pandemic, when we started to hear the vaccines were being created, and there was a push to rapidly get these vaccines into people's arms, and we eventually got there. We eventually got to that point where the vaccines were widely available, and the vaccine campaigns started, as well as the controversy. And whatever drove that controversy, whether it was political, whether it was religious, whether it was whatever it was, there was controversy out there. There was misinformation out there about vaccination, et cetera, et cetera, et cetera. This newfangled, quote unquote, vaccination that was going to be addressing the COVID disease. What were your, and this is the question I kind of wrote to you guys, what was, and maybe even what is, your viewpoint on the COVID-19 vaccination and the boosters? Because I think we all had trepidation to a degree. But let's start again. Let's same order. BJ, how about you? And obviously a person who had COVID. We're interested in what you had to have to say about that.
One thing to say, believe it or not, John, just one thing. Why not get something that would save your life? It's just a shot. Why not get something, possibility of prolonging your life? Because we all saw how deadly COVID was and still could be with this new variant, hopefully not to a degree, but why not take the preventative to save your life? Because you matter to someone, so do what you need to do to save your life.
Mm-hmm. Mm-hmm. Let me just follow that up with another question, because you have, you rely on direct support professionals, and a lot of direct support professionals that we worked with in our project, and vaccination information and vaccination hesitancy, all that stuff. A lot of direct support professionals were a little bit, they didn't want to get the vaccine initially. Did you ever have a worry that your direct support professionals weren't going to get vaccinated or anything like that?
Well, I would talk to them, but it was ultimately their decision if they chose not to. But I would say to them, I'd rather have you here than not, because I need you to be here to have the life that I value. And I value having you in my life because you've made my life better just by being here and being present. My DSPs are they don't only work for me, they become my family. So if I care about family, I care about them too.
Yeah. BJ, man, that's why I love you, because you're a selfless person, and I appreciate that, because it was concerned more about them than you and to a degree. So thank you. Nikita, what about you?
Yeah, we were all, because of what we went through here with losing someone, I think when the vaccine became available, there was a mixed reaction, but more so there was relief that I observed because there was something tangible to help, because we were in this situation where we were coming to work every so often. There was someone had a symptom and then everything was shut down and everyone was on high alert. So mostly there was relief, and I felt relieved as well that it was being taken seriously enough to rapidly get something for protection. But there was also apprehension and uncertainty around, if certain, it was a mix. Like some staff weren't sure, some staff were really excited about it. I was kind of in the middle trying to navigate it. But ultimately, I'm very happy that it became available, especially for us working in this setting.
Did your provider organization that you worked for at the time, did they provide access to the COVID-19 vaccines?
Yes.
That's good. That's good. That's really good. And Caitlin, I'd be curious about your viewpoint on vaccines. The assumption is, yeah, you're all for it, but I don't know. I'd like to hear your viewpoint.
I am all for it. What Nikita said really resonated with me. It was just a feeling of relief when I got the vaccine. In fact, this is going to sound silly now, but like I cried. I was it was such an intense 2020 that we felt as epidemiologists that help was finally coming. And that was a very emotional moment for a lot of us. The Commonwealth Fund just came out with an analysis a couple months ago that the COVID-19 vaccine saved 3 million people in the United States. And that statistic is mind-blowing to me because I could not imagine losing another 3 million people over the 1.2 that we've already lost. So yeah, definitely pro-vaccine. Let's do it.
Yeah. And that's part of our job, especially with the populations with whom we work with in our organizations, TASH and NADSP. There's a large piece of what we do is about protecting people from, diseases and stuff like that, supporting people's health and wellness. It's part of our on our code of ethics, actually. But let's go to a little bit more deeper question here. And this probably, Nikita and BJ, for you, what have you learned, as a person with a significant disability and also a direct support professional doing what you do? What have you learned from going through such a challenging time? Probably one of the more challenging times in our lives, if not the most challenging time we've ever been through in our lives. BJ, did you learn anything about yourself?
Well, for somebody who got COVID, and oh, by the way, just for full disclosure, I was home safe and I still got COVID. I didn't go anywhere. Once that came down, I was home safe and still got COVID. So you don't have to be outside in the community. You can be in your own home and still get COVID. But one thing I learned is every moment in life matters because you're not guaranteed tomorrow. Because I didn't know what COVID was going to do to me. I just hoped and prayed that it wasn't going to be bad. And luckily for me, it wasn't, because I had gotten one of the vaccines and then was diagnosed with the COVID. And, every moment in life matters. So don't waste the moments in life that you have. That's what I learned.
No, appreciate that, BJ. Just real quickly, so did you get the 2-dose vaccine? Is that the one you did? And then you said you got 1 dose and then you got COVID?
Yep. 2 doses and then, yeah.
Oh. I mean, and maybe this is also for Caitlin, but do you think that was part of what mitigated your COVID experience? Do you think that had something to do with you not having more serious symptoms?
My doctors believe so, and so do I. So if the doctors believe so and they tell me it lessened my symptoms, I believe them.
Mm-hmm. Okay. Interesting. Nikita, any great moments of learning, self-awareness?
Definitely self-awareness, I kind of stepped into the leadership role, right? The day of the pandemic, March 16th, 2020 was my first day. So
Mm.
it kind of forced the whole entire experience forced me to be even more of a leader and be more flexible and open and understanding. It was a very emotional roller coaster. I'm sure I've grown as a person. I can't really put it into words right now. I'm having a brain freeze moment right now, but there were so many challenges that I had to navigate, you know, to support both the people we support and the staff who are trying to navigate and live and function and work in this pandemic. So I guess patience, maybe a little more patience, and I can't end the sentence, but I learned a lot. I've grown a lot as a person. And I do have a lot more respect for I already had respect for DSPs and the job, but to have gone through something like that, to have witnessed that, I remember the nurses were getting shout outs around the world, but the DSPs also were in that. They were in these group homes providing services and care in the middle of Department of Health mandates, lockdowns. People still needed staff. So I have grown in even more immense respect for the profession of direct support.
Wonderful, wonderful. That's great. And Caitlin, any great life lessons?
Yeah, like Nikita, I learned so much in 3 years. I think the biggest lesson that I learned, though, particularly around vaccines, is the power of equipping trusted messengers. And that our health information, public health information, is no longer necessarily dictated by authorities, but it's networked by peers. And having trusted messengers equipped with really evidence-based information is critical. One thing that I guess resonated with me, that was what BJ said, is that he was a trusted messenger to the people around him and convinced them to get vaccinated. I think a lot of people don't take into account how much power they have when talking to family and friends, and that it was a game changer. And I hope we can learn from that, not just for COVID, but other vaccines that are unfortunately decreasing in coverage right now.
Yeah. Look, we've got time for one more go around here with a question, and it's I guess a future question. What are you going to do to prepare? Like, you gave us some what to look for. I love that metaphor that you used, Caitlin, that, you know, we can see the storm with this variant or whatever it was that you indicated that's coming, and it could be, you know, could be a hurricane, category 5. It could be, you know, a little shower. So we know that there is the possibility for some nasty germies heading our way. So I'm going to ask each of you, what are you planning to do, given what we've been through, given what we've learned, given all the things we know now about vaccines and their safety? What are you going to plan to do to protect yourself this upcoming indoor season, a season of respiratory illness probably going to be spreading? What are you going to do? BJ, you got anything in mind in terms of getting vaccinated, masking up? What are you going to do?
Probably mask up, and if there's another vaccine that becomes available, get it, because I have too much work to do to worry about getting COVID. Way too much work to do, and I want to continue the work I do for those with IDD and developmental disability, not only in my state but around the country. So I need all the help I can get to continue the work I do. I need my DSPs by my side. I need to be healthy to continue the work I do. So I'll do whatever I need to do to stay healthy.
Good. Please do, BJ. Please do. We need you. The world needs you very much. Don't be getting sick. Nikita.
Yeah, I want to try to be more active and proactive, and just eating my vegetables, drinking my water, working out, getting adequate rest. So, a lot of time we get burnt out in this setting. So I've actually been getting burnt out myself, and I know that can kind of lower our immune systems as well, like stress and exhaustion. So I just want to be able to take care of myself in that way, and then just continue to be an example for those around me, and just get the information like this was great that I could kind of pass along to the people that I work with and that I know. So that's great. Continue to be a source of information and encouragement.
Great. Thank you. And Caitlin, what are you going to do? 'Cause
Yeah.
you can preview things. You're lucky.
I do. I kind of know what's coming down the pipeline. So I'm going to get a vaccine if I'm eligible. Big meeting at CDC's on September 12th, everyone. If we will know then who is eligible and who is not eligible for a fall vaccine. I will say whispers in the street is that everyone will be eligible for a vaccine. So put that on your calendar. And so I'll get a vaccine. I'll wear a mask, particularly in indoor crowded areas, like when I'm traveling, so I don't get sick like BJ. I don't want to miss out on anything. And like Nikita said, I loved what she was saying is keeping physically healthy, but also emotionally and the mind healthy as well. It's not something that I've done well the past 3 years, and it's something I'm trying to improve going forward. So we'll to be determined, but all of the above.
Yeah, great. Well, I ditto all of you. I'm going to do everything you all are going to be doing. But I think one more thing, I'm going to try to focus on being, and I try to do this anyway. And, BJ, you teach me this a lot about kindness. Kindness is very important. I think that's what I've learned, because I think we've seen the best of human beings during this pandemic. We've seen the worst. And I think I prefer to be with the people that are kind and loving and patient and are willing to sacrifice certain things and be good, try to be a good person, because we need that. The world needs that, more of that. So look, we're kind of at the end of our time. We do have just a few minutes I wanted to reserve for any questions or comments that people have. Donald and Shanette, I don't know if you've been monitoring the chat box, but Donald and Shanette, without Donald and Shanette, we wouldn't have had this webinar either, because they helped to organize it all. So any pertinent questions we have? Doesn't look like it when I look in the chat box.
Yeah, we don't have any question in the chat.
Okay.
I see in the Q&A.
I was going to say in the Q&A, there's a couple that have there's one currently up from Bethany Keener.
Yeah, it says they're planning a vaccine clinic in October, but they don't have any clear answers about when the new COVID vaccine will be available. So about the timing, like I said, September 12th is going to be that big CDC meeting to determine who is eligible. But that doesn't mean it's going to be available September 12th, because it needs to be sent out. Pharmacies need to get set up. So I think that the federal government is telling everyone by the end of September should be a good time that vaccines will start being available to people. So there's an answer.
Okay, that's great. I have a question, Caitlin. So when you say vaccine and booster, is it different? I mean, that might be a loaded question that might take a long time to answer, but what's the difference?
There is no difference. And we're actually having a very big debate about what to call it right now, because how the CDC is moving is that you're not up to date unless you get your fall vaccine. And so really this is a shot, and we should be calling it a shot rather than a booster, so people understand that they need to keep getting it to be up to date. It's not just like an added benefit. So I think we're trying to lean towards more of using the word shot than booster.
Oh, okay. All right, that's cool. And the other thing, just kind of a little bit of a follow-up in terms of the nasal version. Is that going to be something additionally to a shot or in lieu of a shot?
Yeah, that's what they're trying to figure out with the science right now. It looks like a nasal vaccine is, so if someone's unvaccinated, they're still going to have to get the primary series of a shot and then thereafter get the nasal vaccine. But there's so much yet to be determined with these nasal vaccines that it's going to be years. So yeah, hold on tight with that.
Okay, cool. Well, look, I don't think there's any other questions. It doesn't-
There are some questions in the chat box.
Oh,
One is
okay.
from Catherine, what message do you think best resonate with people who are vax hesitant to or fatigued?
I'm sorry, could you say that again, Jeanette?
Yes, the question says, what message do you think best resonate with people who are vax hesitant?
Oh, man. What, oh gosh, that's again a loaded question, right, Caitlin? I mean, vaccine hesitancy is a real thing, but do we have any suggestions for helping people become more comfortable with it?
Yeah, it's something that I think it sounded like BJ did really well, is that one, a lot of people don't realize that 40% of unvaccinated decided to get vaccinated because they had conversations with their family and friends about the importance it was to them that they're protected. So I know that goes a long way. Another really important part, which is very difficult to do now that we're 3 years and exhausted, is to listen to them, not hear, but truly listen to their concerns from a place of empathy and start chipping away at their questions.
Right. Thank you. That's sound advice. Let's see, one more question here. A couple of independent living centers in Alabama are partnering under the United States Aging Grant to provide vaccines and coordinating this in our state, focusing on our rural counties, that's great. I'm glad that's happening. Do you have suggestions, Caitlin, on timing of these kind of efforts? They're going to also be offering flu and RSV shots.
Yeah, so RSV shots don't wane, so people can get them right away, and it should last an entire season. It may even last 2 seasons. Flu is better, closer. Flu does wane, and it's closer to the waves is better. So typically we suggest October. COVID is the tough one, and I tell people if they want their COVID shot to help protect against infection, to get it as close to a wave as you can, but that timing can be challenging. So I don't have a good answer for the COVID one, but I personally will be trying to time it with the winter wave.
Great. Wow. Look, we are out of time, and we could probably go another hour easily, but we can't do that because we've got things to do. BJ's got people to talk to. Nikita's got stuff to do. Caitlin, I'm sure you got stuff to do. Thank you to everybody, and I just want to make sure I thank everybody for their involvement and the production of this webinar. I want to certainly thank you, Linda, our wonderful interpreter. Beautiful job. I don't know how you do it. It's amazing. It's a wonderful skill. Donald and Jeanette, thank you so much for working with me over the last couple months organizing this, and certainly Mike Brojali, my friend Mike Brojali, and the leader of TASH. Thank you so much for this partnership and this webinar. It's been great. And Nicole Dama in the back room, making sure all the bells and whistles and everything works. Thank you. And most of all, thank you, our wonderful panelists. Caitlin, Jetelina, fabulous. Thank you for making something so complicated, making it so easy to understand. Thank you. We need you. And if you don't follow Caitlin, you can. I think there's stuff in the chat box. I'm following you now. And just don't get creeped out by that. I'm following you because of your epidemiology skills. And of course, my friends and my colleagues, BJ Stasio and Nikita Smith-Rashada. You are awesome. You continue to always inspire me and challenge me and make me happy that I'm affiliated with both of you. So Everybody else, all the audience participants, thank you so much for joining in. This will be recorded. It's been recorded. It's going to be in our archives. And if you want to know more, always feel free to reach out to www.nadsp.org and certainly TASH, which is, I believe, www.tash.org, if I'm not mistaken, Mike.
Tash.org. That's right. Thank you.
There we go. And other than that, stay safe, everybody. Enjoy the end of summer, and we will see you down the road. And again, thank you all for this wonderful hour together.
Thank you.
Thank you. Be
See
well.
you soon, John.
See you, Vijay.